Imagine a tireless detox factory working 24 hours a day, 7 days a week. That's your liver. It's the organ responsible for detoxifying almost every substance that enters your body. Because of its crucial role, the causes of elevated liver enzyme levels, liver function indicators, are incredibly diverse. We often reach for supplements, vitamins, herbs, powders, thinking we are giving our body a boost, a helping hand. But what if the very products marketed for health are secretly overloading our detox factory? What if the supplements you are taking right now, misused or misunderstood, are putting your liver at risk? Today, we pull back the curtain on 5 common supplements that, when consumed carelessly, can directly damage the liver. We'll call them the 5 silent saboteurs. Pay close attention, especially if your liver enzyme levels, AST and ALT, aspartate transaminase and alanine transaminase, are already high. Saboteur 1, the identity crisis. Our first saboteur is a superstar nutrient that has recently gained massive attention, vitamin B3, also known as niacin. This vitamin has impressive clinical backing, showing results like increasing the survival rate of non-smoking female lung cancer patients by 50% in clinical trials, and even preventing skin cancer by 30%, according to findings published in the prestigious The New England Journal of Medicine. But here is the critical distinction. Vitamin B3 is divided into 2 types, nicotinic acid and nicotinamide, and these 2 compounds have completely different natures. The one with the significantly higher risk of liver toxicity is nicotinic acid, which we often refer to simply as niacin. Data from the National Institutes of Health, NIH, suggests that taking 500 milligrams or more per day can raise liver enzyme levels, AST, ALT, by up to 20%. And if you consume a high dose, specifically 3 grams or more, liver enzyme elevation is highly probable. Many consumers seeking benefits like cancer prevention mistakenly buy high-dose, single-ingredient niacin only to experience flushing, stinging, and elevated liver enzymes. This confusion happens when they mistake nicotinic acid for nicotinamide. The rule: when buying vitamin B3, always distinguish between nicotinic acid and nicotinamide. Check the label carefully. Saboteur 2, the sneaky enhancer. Our second saboteur isn't the star ingredient itself, but a hidden booster designed to make the star ingredient look better, piperine, often listed as black pepper extract. Take curcumin supplements, for instance. Curcumin itself is generally low risk when it comes to liver impact. However, the National Institutes of Health, NIH, ranks its potential for liver toxicity as A, and the reason isn't the turmeric component, but the black pepper added to boost curcumin's absorption rate. Piperine interacts with other substances and drugs, potentially increasing or decreasing their levels in the body, which raises the probability of affecting the liver. This isn't just an issue with curcumin. Piperine is mixed into various health supplements, including CoQ10. If you are taking prescription medications, such as those for blood pressure or diabetes, it is strongly advised to choose products that do not contain black pepper extract or piperine. Saboteur 3, the quality control failure. Our third saboteur has a noble history, ashwagandha. This good ingredient has been used for thousands of years in Ayurveda, India's traditional medicine, to address stress, fatigue, anxiety, insomnia, and malfunction. Recently, it has even been approved in South Korea as an individually recognized ingredient to aid sleep. But despite its history, the US NIH classifies ashwagandha as a B-grade compound concerning potential liver injury. Why? The issue primarily lies in the quality of the raw material. The NIH points to errors in commercially sold products or the potential mixture of other ingredients as the cause of liver toxicity concerns. If you want to safely consume ashwagandha, you must select trustworthy, verified raw materials. For example, among global suppliers, the most famous and widely used are the extracts made by India's Biomed, which uses only the root and has undergone dozens of clinical trials supporting its use for stress, anxiety, male health, and memory. Another highly reputed source is Sensorial, an extract using both the root and the leaf, which is often emphasized for relaxation and tension relief, and also backed by clinical data. The rule: when seeking ashwagandha, stick to globally renowned, clinically backed sources like Sensorial or the Biomed root-only extract. Saboteur 4, the polluted superfood. Our fourth saboteur was once a major health craze, noni. Promoted for its antioxidant, weight loss, and skin health benefits, noni spread like wildfire. However, this superfood came with a massive controversy involving heavy metal detection and cases of liver toxicity. Domestically and internationally, noni products were found to contain heavy metals like lead and cadmium at levels exceeding safety standards by tens of times. Naturally, these substances place a heavy burden on liver cells. The biggest problem? The source of many noni materials, often collected from Southeast Asia or the South Pacific, is often unclear and difficult to verify. There is frequently no clear data on what other components are mixed in or whether contamination has occurred. While sold under the banner of superfood, the safety of many products simply cannot be guaranteed. This doesn't mean all noni is dangerous, but it requires careful scrutiny and filtering of products. If you have existing liver disease or already high liver enzyme levels, noni requires extreme caution. Saboteur 5, the trade-off. Our final saboteur is ubiquitous in the diet industry, Garcinia. Its key component, hydroxycitric acid, HCA, works by suppressing fat synthesis, reducing appetite, and aiding weight loss. The problem is the significant liver toxicity issue. There have been reports of consumers developing acute liver injury, jaundice, fatigue, and elevated AST/ALT levels after taking Garcinia, sometimes requiring hospitalization. The connection between Garcinia and liver damage has continuously been reported in international studies and case reports. Due to escalating safety concerns, the Korean Ministry of Food and Drug Safety conducted a reassessment of Garcinia, resulting in a significantly lower maximum consumption limit. The risk is real and cannot be ignored. While short-term low-dose consumption may not cause major problems, long-term high-dose use can severely burden liver health. The warning: losing weight while simultaneously destroying your liver is absolutely not a profitable trade-off. Final advice and the dose principle. Beyond these 5 main culprits, other common substances can affect the liver, including excessive protein, black cohost used for menopausal symptoms, high doses of EGCC from green tea extract, and excessive selenium. We must also be wary of complex herbal blends often found in overseas products. Remember the profound wisdom of Paracelsus, the father of toxicology. All substances are poisons. There is none which is not a poison. The right dose differentiates a poison and a remedy. If you are concerned about your liver health, you must manage your supplement intake carefully. Know exactly what ingredients you need, how much you should consume, and ensure there is no harmful ingredient overlap. Most importantly, choose ingredients whose long-term safety has been verified. Consult with an expert, confirm the safety profile, and ensure you are not accidentally asking your detox factory to manage a toxin disguised as a tonic. Key takeaway: the greatest risks associated with supplements often stem from 3 factors: high dosage, ingredient confusion, and poor quality or contamination. Specifically, be cautious of high-dose nicotinic acid, niacin, hidden piperine in supplements, unverified ashwagandha and noni sources due to heavy metal risk, and long-term high-dose Garcinia use. Always verify the raw materials and consult a professional before starting a long-term supplement regimen. That's it. Thank you so much for watching this video, and we see you on next video. Until then, stay healthy.